Македонија проблемот на малолетна употреба на дрога, односно употребата на дроги од страна на малолетни лица, во последно време зема се поголем замав. И еден од главните проблеми кои што се јавува при тоа е третманот, односно лекувањето на малолетните лица кои што употребуваат, односно или се зависни од дроги. Именно согласно постоечката законска регулатива и протоколите, во нашата земја единствено лицата со наполнети 16 години може да се лекуваат со субститут, и тоа со двата, и со метадон и со бубренорфин. Сите оние лица кои што се под 16 годишна возраст едноставно немаат опција за лекување.
Зависноста од дрога е диагноза која речиси е загарантирана за младата популација. Почетокот на употреба на дроги кај младите започнува според ЕСПА студијата што ги вклучува децата кои одат во училишта е некаде на 15 на години. Што значи станува збор за малолетни лица. Знаеме од студијата изработена од невладината организација ХОПС дека има деца кои се малолетни и баш се деца и под 10 годишна возраст и 8 годишни деца кои употребуваат најчесто испарливи растворувачи, но има случаи на употреба на опиоиди.
Само во текот изминатата година ХОПС има исконтактирано со повеќе од 30 лица кои што се малолетни, кои што употребуваат дроги. Еден дел од нив се уште не се спремни за лекување, односно немаат желба да се лекуваат, меѓутоа веројатно и мотивацијата за лекување ќе биде многу повисока доколку во државата постои програма за лекување на малолетни корисници на дрога. Во таа насока беше организирана студиската посета во месец мај оваа година во Виена, каде што група на луѓе кои што работат во институции кои што се задолжени за третман на малолетни лица зависни од дрога, има можност да ги посетат програмите за третман, намалување на штети и рехабилитација на малолетните лица во овој град.
Good morning.
Welcome.
How are you?
Е посетени поголем број на организации и институции кои што нудат програми за малолетни корисници на дрога. Тоа се организацијата Диалог, Каритас и Едмаер. Сите овие организации нудат еден комплементарен сет на услуги, така да Диалог како организација беше посочена од страна на сите институции како организација која што е референтна во однос на третманот на малолетни корисници на дрога. Меѓутоа истата организација нуди и шелтер центар, програми каде што се програми за ресоцијација и рехабилитација на малолетните корисници на дрога.
Ideally, a client will have psychosocial treatment as well as a medical treatment. And so these two workers who are concerned with one client really need to coordinate themselves and speak about what came up in one part of the treatment and exchange and plan what direction the treatment plan is supposed to go.
3 psychosocial staff members on duty and 2 doctors, and when the youth opening hours are, we have 1 doctor and at least 2 staff members, social worker, psychologist, and 1 at the reception desk also.
The good thing in psychosocial sessions is we have really an hour to sit down and talk about what has been going on. How do, I don't know, for example, relations with parents, with partners, maybe with kids they already have. How does all that play into their development? How stable, how unstable they are? Do they have troubles in terms of jobs or in terms of, I don't know, what kind of education I could pursue in order to build some perspective? I mean, all these aspects of life that they can be covered here. And we have the approach that anything that is relevant to the clients is good to be brought up, and we can talk about anything that is meaningful to them.
Во Диалог чекорите за пристап до програмата за лекување се на некој начин последниот редослед. Лицето кој што доаѓа на програмата најпрво разговара со социјален работник и психолог, кои што понатаму одредуваат дали тоа лице е спремно за лекување и ставање на медицински третман или е сосема доволно да биде дел од некоја психосоцијална програма, односно без употреба на на медицинскиот модел. Доколку се одлучи дека лицето во овој момент е спремно за лекување, се препреќа до доктор и психијатар кои што ја одредуваат дневната доза и видот на лекот.
And do you know what is the second problem, or maybe first? I'm not sure if we open some program of that kind of a program in this moment, that we will have kids inside, because the way to reach them is very difficult. And I'm not sure that a lot of them will come for treatment. Okay. Especially because they are minors, their parents have to sign.
It's not always easy for young people to actually want treatment right away. So for various reasons the approach had to change compared to how we deal with adults, and towards young people the effort we put in to stay in contact with them, to call them, to try to invite them back in, will be much more extended than compared to what we would do with adults.
We have a system where our social workers are also, even also we as doctors, we are calling our clients or send them an SMS if they are not showing up, not to argue with them, but to say we care for you, we invite you to come back and we want to help you in your situation.
So then I contacted my colleagues, and then we started thinking how the child will be proceeded in the future. So my expectations primarily would be, where is the pathway that the child with this, probably I might or I might not know that it's a drug addiction one. So if it comes with a pediatric situation or pediatric morbidity, I should know what I should do first, then how I should gain all these people around me, and where to proceed with him or with her, how I can deal with the family, with the child, what I should do to detoxicate. We are asking these things from the adult clinic who is working with the toxicology, but I think that I should make my unit. So in this emergency situation, we should know what we should give, and not always contact them on the phone, because it might be 2 o'clock in the morning, so you should know what to do immediately.
Also, after these first appointments, I said the clearing would be 3 to 4 meetings, but it could also be that after this first meeting, we already have a referral to make.
Of course, we need a clear diagnosis of the addiction. We can get this diagnosis by the urine test, but also by clinical observance. We ask the clients to come without having consumed, so that we can see some clinical withdrawal symptoms. Then we can start substitution therapy, because clinical withdrawal symptoms tell us that there is a body addiction already.
Treatment of minors is a very delicate thing, particularly when it comes to substitution treatment, as this is a very delicate area of treatment anyway for young people.
The first line substance is buprenorphine, or buprenorphine with naloxone. We also have the possibility, if we already think that with buprenorphine we will not have good results, and the patient is rejecting it, saying I have already tried and it's nothing, it doesn't help me, to start with methadone. Then after the initial phase, switch to L-polamidone, which has less side effects and is better tolerated.
Значи, во однос на медицинскиот аспект можем да кажем дека ме воодушеви храброста на колегите, но веројатно имаат и поддршка за тоа.
I think it's a little bit different in Austria. Indeed, it's so that methadone hasn't got a registration at all.
I mean, the status of legal approvement and being in use is something very different. Methadone, even by the laws, as a substitution, legal regulations on substitution, methadone is, together with buprenorphine, is the #1 substance that should be used with new people coming into substitution treatment. So the one thing is a very legal aspect, but there is no problem with the insurances to cover methadone treatment, and there is no legal problem for medical doctors to prescribe methadone.
Нити фармацевските куќи се спремни да регистрираат лек се таа возраст, мене апсолутно ми е јасно зашто е тоа така, а нити регулативата е спремна нешто да промени, они се спремни да работат сепак имајќи идеја дека така спасуваат животи.
But few medications have legal registration for young people, very few, and so if the whole welfare system or the medical system would stop using the drugs that by experience are quite helpful and important, I don't know, the treatments would break down. And so for that reason, we also have, I mean, for the substitution side, some internal regulations that really gives a guideline where we as an organization came to the conclusion that within these limits it is okay and it seems reasonable and sound to do a certain treatment, but not to go beyond.
We need the agreement to the therapy of the legal custodians, but we are able to start a necessary therapy without that agreement. We try to get the agreement within the first 3 weeks of treatment, because this is a time where a therapy with psychopharmacologic treatment doesn't count as severe treatment. This is especially so for youth from 14 to 18. Under 14, we are not allowed to start the treatment without the caretakers.
Initially, on the psychosocial level, we have a little bit more freedom, and it is easier because only the treatment requires the consent of adults and the parents, or the legal guardians at least. And for us, it is a standard to really put an effort in to actually bring in the corresponding legal guardians of young people. And at times that does not work for various reasons, because, I don't know, that there might not be anybody interested and really following up, even if we try to talk with them on the phone and invite them. And I remember that in this youth program at Gudrunstraße here, when actually medical treatment was absolutely necessary from our side, they would actually call social welfare services and sort of talk about the problem that the legal guardians would not cooperate for a necessary treatment. And then there was a way of actually getting permission from the youth welfare services in order to be on a legal, clear side.
Normally the clients go to the pharmacy and take their daily dosage under supervision there. Only in exceptions they are allowed to take it home. In young clients, we don't give it to them if they go to school, for example, but the weekly dosage is taken to their parents and they give it to them every day before school, for example.
Друга организација која што беше посетена во рамките на студиската посета во Виена е организацијата Јегермајер, која што е финансирана во најголем дел од градот Виена и од Министерството за труд и социјална политика и Министерството за здравство на Австрија. Самата организација е всушност најголемата организација која што спроведе програми за намалување на штети од употреба на дрога. Именно нивната програма за размена на стерилен прибор за имитирање посетуваат преку 600 корисници во текот на еден ден и вклучително тука и спаѓаат и малолетните корисници на дрога, значи самата организација не прави разлика во однос на годините, дали лицата кои што доаѓаат за размена на стерен превоз на интернет се полнолетни или малолетни.
Someone who is 13 years, for example, come for legal exchange, you will give him,
but we will try to get in contact, and we will try to get information about the situation, and we will try to get information about the knowledge of
but there is not limitation by the law if somebody is.
We must not control the age.
Исто така организацијата нуди посебни програми во однос на третман, односно постои можност за лекување со метадон и бубренорфин.
And this solution there, what is that?
This is labor methadone.
You are working on Saturday and Sunday?
We also work Saturday and Sunday, yes.
For not stable people?
Yes, but also for people who are not in substitution therapy here, but who have problems with their medication. They lose the medication, or they can't go to pharmacy. They close at midday on Saturday, and if they come too late, so they can't get their medication, they come here.
One part of the patients take the substitute here, and for one part of the patients you give recipe to the pharmacy. Do they pay for the substitute, or it is free of charge?
Well, they get it here?
No, in the pharmacy.
Well, these people who come to the pharmacy have a regular insurance, and there are not many people, they go to the pharmacy, but we pay the medication for them.
Програми за наоѓање, односно прифаќање, шелтер центри, каде што можат да луѓето преспијат да добијат храна, лична хигиена и така натаму. Постои можност за советување, исто така за едуцирање на лицата кои што употребуваат дроги, за работа со фамилијата, односно за мајките и децата кои што имаат проблемот. Значи една севкупен сет на услуги кои што се нуди во рамките на оваа програма.
And another large aspect of psychosocial tasks is the work with relatives. Mostly it will be parents of somebody who is using drugs, but it could also be a co-worker, a boss at work, or the partner of somebody who is using drugs. And obviously they have lots of questions how to deal with the situation, how to respond, how to react.
И сега, оно што е посебно значајно е дека мора посебно внимание да се обрати на едукацијата на младите корисници на дрога, имајќи го предвид дека тие се наоѓаат во една специфична возраст, каде што многу често се среќаваат со стрес, трауми, понатаму прашање поврзано со собствениот идентитет, сексуалниот идентитет, родовиот идентитет и така натаму. Програмите за третман на малолетни корисници на дрога мора да ги вклучуваат сите овие субјекти ако сакаме да имаме успешна програма.
And we encourage clients to take place and learn about what other people also have problems with and exchange and learn from the others as well.
But we do not only counseling but also these kind of workshops and role plays, and there is a theater project going on in Vienna. It's called the Forum Theater, where it's not just a group playing, but the youth need to step up and offer their solution for the situation they see. So they engage with peers because all the actors are also youth.
And this can range from, I don't know, like self-experience groups, but there are also art groups or some where they cook together and they really learn about nourishment and how to provide them with better meals.
Only as a group here we always had some food for them, drinks and stuff, and sometimes as a program they would cook something together, or before Christmas time they would bake cookies and stuff like that.
Беше посетен шелтер центар за бездомници, вклучително и млади лица кои што употребуваат дрога. Во рамките на шелтер центарот постои можност за ноќевање, за храна, туширање, Меѓутоа постои можност и за развој на стерилни приборци инјектирани.
Our station here actually was founded in 2005. The city of Vienna said that we don't have homeless people, we don't have homeless children, because we have already a social welfare, a youth welfare, and they have space for everybody and they guide everybody. So there was a discussion, if you don't have any other station where those people can go, how can you find out if it's necessary or not? So this was founded as a project. And over the years it showed that there is a lot of children coming from the streets, coming from a lot of different backgrounds. They do not go to the official youth shelter and youth welfare, but they come at least to this here where we don't go immediately into the families and bring those severe programs inside.
And everybody can stay here for 5 nights per month, anonymous, and after that they have to be cooperative, and if they are not, they cannot sleep here. Being cooperative means that we get in contact with youth welfare, and if they do not want us to do this, they can come next month and have 5 nights again.
Исто така беше посетена и програмата за вработување, односно креативна работилница од страна на Каритас центарот, каде што лицата кои што се млади, бездомници, значаен дел од нив и корисници на дрога, имат можност да работат неколку дена во текот на неделата и на тој начин да заработат за собствениот живот, имајќи предвид дека значаен процент од нив не можат да конкурираат на регуларниот пазар на трудот.
We had an exhibition here and a lot of them have been sold and the money has been split up. For the youth which made the pictures, they got a part, and the rest is for the project to make it again. And the both each of them got between 300 and 400 euro just for the selling of the pictures.
Во рамките на истиот центар имат можности да ноќеваат, значи постои повторно шелтер центар.
Accompanying them to the youth welfare department, to the unemployment service, to schools, they can apply again and things like this. For them, they go here to work and get money, but for us it's also to help them to get back in the system, to find additional contacts, to get the resources they could get, but they don't know them, they don't like the adults and things. So it's really a step-by-step approach.
Психосоцијална поддршка значи да децата се уклучат во работни задачи, а не да посетуваат социјален работник само и да разговараат со него или и тоа да не го прават. Значи да се уклучат во работа, да се оспособат за работа, и тоа не е само за децата, тоа е уопште за целата целна група. Да им се отворат работни места, да им се отворат ангажмани, да се обезбедат со домови, заштит некаде, можат да под супервизија функционираат или учат како што се реформите во психијатријата, да се извадат од болниците, да се вратат во заедницата.
Оно што остави посебен впечаток е тимската работа во програмата за третман на малолетни корисници на дрога, во сите програми кои што ги посетивме, а посебно во диалог. Именно имајќи предвид дека проблемот не е само медицински, туку е социјално и психосоцијален проблем, потребна е константна работа, односно заедничка работа на целиот тим кој што е вклучен во третманот на малолетните корисници на дрога.
I mean, our approach in a way is really, let's slow things down, yeah? Let's try to establish some stability and then see where you want to really go. And sort of course, to get somebody out of the illegal context is very important, and to improve health issues the best you can. But at times it is really so important to, I don't know, improve social relations, to find some occupation, maybe finish school or start some training. And if these other areas in life actually start to work and function, then the reduction of substitution is not the issue for the patient anymore. But if you only focus on the substance, they will fall back and get very unstable, because the consume of drugs is in a way an approach to cope with their lives.
Значи, кога размислуваме за развој на програми за ова третма и рехабилитација на малолетните лица, мора да го земеме предвид и овој контекст и соработката на невладините организации со институциите кои што нудат третман и секако центрите за социјална работа, односно програмите на Министерството за труд и социјална политика во однос на прифаќање и работа на овие лица, посебно на децата на улица.
I mean, to provide services is important on the initial phase, but to actually really secure programs for a longer time, there also needs to be a political consensus that what kind of approach towards drugs and drug treatment is the will of the political parties and the people in general, in a way. So, but of course that's a long process in order to set something like that up. And we are fortunate in a way that over the last 30 years in Austria and in Vienna in particular, we have quite an elaborate and good circumstances and political will that has quite some knowledge and understanding that you cannot just make like this and everybody will be clean and stable.
For now, it's just that I would be interested in what is going on in Skopje and Macedonia, and what will happen to these kids that you talked about who are so young. What kind of services could be established for this age group that is so that needs to rely on parents so much, and where legally we can't really do much under the age of 14 for kids because of the laws. So that's a big issue, and I would be very interested what would come of it, and probably we could learn a lot from what comes of these situations.